in front of you are 3 light switches, just ordinary light switches, and above you is 3 light bulbs. But you're in the basement, so you obviously can't see them. You want to set the switches one time, go up and be able to say, oh, that's switch 1, that's switch 2, and that's switch 3. There's no fancy wiring. It's just wire from the switch to the bulb, switch to the bulb, but you don't know what it is.
The problem is I've heard this riddle and I can't remember.
That's even worse.
It's even
Okay,
worse.
welcome back, everyone. Thanks so much for coming back for us for the afternoon of the second day of the Saam class. What we're going to be doing, focusing on, we're going to be doing cases, and then at some point soon too, we're also going to be treating. So we'll be focusing on that. That's what our afternoon looks like. But if it's okay with you, Dan, can you put on your video, and I'd just like to check in with you. I'm still just seeing the rock. Okay, great. Hey, Dan. Does he have audio too or no?
Uh-huh.
Great. Okay, great. Hey, Dan, how's your class going?
Good. Very well.
Do you have any feedback for me?
No, I'm just absorbing all of this.
Great.
So, like six pages of notes and counting. So.
Okay, that's great. That's great. I think Billy might be slightly ahead of you, but not by much. Dan, I was wondering, do you have any questions for me about the Saam system, about employing it tomorrow in your practice in Oakland? I know you've been in practice for 4 years now.
Yeah. So one of the questions I have, I'm just trying to kind of reconcile this, is, in TCM, DAMP is, spleen chi deficiency. It's not transforming. And so
pause just for a second there, Dan. But isn't that just exactly perfect for us with the Saam system? And then we think about herbal medicine, right? What herbs tonify, even though we should say supplement the chi? It's all our dryers, right? All the damp is, the spleen is too wet. So Baiju, Sangju, Fuling, all of our spleen supplementing points all dry the damp. Isn't that interesting?
Okay. All right. I think that answers my question.
Oh, no, I didn't mean to cut you off. I just want to make that point. It's just interesting. Using the Saam lens, a lot of things make a lot more sense in Chinese medicine.
Yeah, no, that's why I'm trying to reconcile, because it seems like we're not tonifying the spleen to solve damp. We're going over to the large intestine and tonifying the large intestine.
The other side of the coin.
That.
Yeah.
So,
yeah, so just like we do with herbal medicine, to tonify the spleen, we dry it.
Okay.
Right?
Okay. Yeah.
Yeah, I mean, again, things make a lot more sense. And I believe there's a classic. Dan, do you know the classics very well?
No, I didn't say that I do.
I think we'll have somebody here. Dennis, do you know the classics well?
Do I know the classics well?
Uh-huh.
I've probably forgotten more than I know.
Okay. Do you remember somewhere in the Suen, I think it's like spleen likes dryness or something like that, right? Isn't it?
Yeah, I agree.
Okay, yeah. So somewhere that, it's all, again, Saam look at these texts and then just made a system for us so we don't have to keep looking at the confusing text, right? He just gave us a nice clean system. So, okay, I have one more question for you. Because you guys get a new system, but I get book recommendations usually here. So the book recommendation you had is by Hamid. Yeah. Can you give us a quick book recommendation for everyone here? Why would you recommend that book?
Well, one of the things I'm interested in is the psycho-emotional, spiritual evolution and support that our medicine can provide people.
Same.
And so this book goes really deeply into the classics. You study with Jeffrey Wen, so it's based in the classical tradition.
Oh, great. That's my teacher for 10 years.
Yes. So it's the Hun, the Po, all the breakdown, just kind of how that integrates into the underlying underpinnings of common diseases we might see. Kind of as a hidden root, as the title might suggest. And I think that's really valuable because that just resonates with me, that whole spiritual, psycho-emotional aspect of our being and our evolution as humans.
Great. Thanks so much. I'm getting that book, so thank you.
Can I repeat the name of the book?
Kate will write on a piece of paper and we'll pass it around. Okay, thanks a lot, Dan. So don't hesitate. Reach out to Kate, anything that comes forward with you guys. Anyways, I just realized I could look at you and talk to you. I'm so excited. I'm sorry it took a day and a half to figure that out.
No problem. No problem. I'm on Zoom quite a bit, so I'm enjoying the opportunity to have my video off and
Okay.
not be on stage.
Okay, great. Well, it's nice to import you here. It's warm with a cool breeze, so real pericardium weather right now. So,
Awesome.
okay.
And shout out to Dennis. Hi, Dennis.
Again,
All right.
again.
Okay, nice. Nice. So many connections. Okay, great. What are we doing now? Leslie,
I think we have another case, is that correct?
I believe we have another case.
Wait, we had a case.
49-year-old female. We haven't finished.
Oh, this finished our case.
I don't know that we went over my case either.
Oh, we small intestine,
Okay, I know.
stomach. Leslie, what else? Heart. Okay. Okay. I lost something. All right. So, are you comfortable with those recommendations, Sarah?
Yeah.
What side are you going to put all those on?
Right side.
Great. Okay. Oh, you know what? I need to go back to. So we captured everyone's stuff, right, Leslie?
Yes, no, we haven't started that at all. I think we,
The 49-year female. We presented her case.
and we.
Shauna she contributed a very key aspect for this case with the warm feet. Remember?
Okay.
I remember this now. It's all coming back to me.
Coming back.
Some Sanjo access don't have great memory. It's all blanking out, especially when they're really Sanjo access when in the bright light. In the dark room, I'd have all this back like in a second. Okay, and so then we were just about to capture your information from the class.
Correct.
Okay. Kate, can we have a whiteboard, please, and we'll capture this? And then if you can get everything from the... And Dan, well, I'm looking at you now. Make sure that you get this well, okay? Dan, I would like I'm putting you on the virtual digital hot seat. Dan, I would like you to come up with an extremely good name. Everyone's getting a little bit tired, and so they're going to need a good name. And then 3 channels you would like to supplement for that case. Remember, she's got warm feet in addition to all the other stuff we did. Thank you, Dan. Everyone else here, break them up into groups and work.
They were already broken up into groups and worked, and then we went to lunch just before we took the next
Dan,
step.
what is your team name? Unmute and tell us, please.
Our team name is going with Kate, help me out. What's our
Dan, Kate's are busy with all the tech work. She can't be Kate Interact. Everyone's.
It's the online group, whatever our name is. We haven't come up with a new one. We've been busy talking about the case details.
Yes, there's a new fantastic name for
What is it?
Good Samaritan.
Okay, great. Great. It's sort of a biblical thing and a Buddhist thing and a Christian thing. That's good. That's a nice yin and yang. Okay. Go, Dan, with your channels and the sides.
Okay, we the consensus that I believe we came up with was Sanjiao. First is Sanjiao supplement on the right.
Mhm.
Spleen supplementation on the right, second choice.
Okay.
And small intestine supplementation on the right is the third choice.
Okay. Why do I agree with your Sanjiao being such a great opening salvo?
I don't know why you would agree with that. I can imagine that it's because the darkness is probably a liver, dark, cool place, and
Dan-
Sanjiao would bring out into the sunshine.
We are so lucky, right? This patient diagnosed herself and brought it to us, right? I've got darkness. Do you have anything that could help with that? Oh, yes, we do, right? Dan, in your 4 years of clinical experience, do patients every once in a while come in and tell you what they need to do, but not usually? But then when they do, then you feel a lot of confidence when they say, I've got darkness. Don't you have a brightness thing that you could help us with?
Beautiful thing.
So you and I are on the same page with the Sanjiao. Make your case for why you want to supplement small intestine. Dan, she's model pretty.
And what's that?
She's model pretty.
She's model pretty. Well, there is the symmetry and the attractiveness.
Yeah.
There's also the slightly thin pulse, I think, was in discussion, blood deficiency in discussion. With my notes here. Thought also the benign breast lumps might be a consolidation, which would be kidney.
100%. 100% I think about that as a consolidation, right? So we always, when we have breast lumps, do we want to consolidate them or move them, Dan? Exactly, right? So I really like that. There's one more thing I was thinking about that's like slightly theory, but good. Do you remember what her menstrual cycle is like?
No, I don't remember the quality of the.
This all comes on just before her menstrual cycle. Is there a tendency just before the menstrual cycle to have blood stasis things in Chinese medicine?
Yes.
Okay, so she's having darkness and blood stasis just before her menstrual cycle. So I think this is fantastic. Between your two channels, we've really captured what's going on with her, right?
Right.
Okay. Your third idea, which is stomach, can you make a case for that? I don't like that as much.
They had spleen. The group had spleen.
Oh, you had spleen? Sorry, it's just written incorrectly here.
Yeah, somebody else, I think somebody else might have had stomach in the chat, but
Okay. Anyways, someone in chat, could you make your case for stomach? And Dan, I love your spleen idea, right? Because body type is perfect for this, right?
oh, no, you're right. No, the group had stomach. I had a spleen note.
Okay, Dan, you're doing much better than the group.
Okay, I don't understand the stomach side, so somebody else would have to speak to that.
Yeah, but someone's that really likes stomach is gonna let Kate know, and so we can discuss that. But I love your spleen one because she's really thin and really dry, so perfect for spleen, right? Again, I don't have a great way how that's gonna help with her darkness and blood stasis prior to menses and all that. We don't, but constitutionally, she's large intestine excess, so we're gonna have to look at what I did, but I love your order and your channels, Dan. So thanks a lot.
Question on the night sweats and the feet being warm. Is that a yin deficiency, which would also be a spleen?
Dan, usually we don't talk about yin deficiency in this system just because it's just confusing. So we just try and focus on the order. So if remember these night sweats are just occasional. So I just put that in there because she told me. I think it's not that important, but so occasionally she has night sweats. What is the nature of sweat as far as pathogenic factors or physiological things in the body? What is it? Sweat.
Well, I'd say sweat's going to be an external dampness.
100%, Dan. I'm exactly with you on that. 100% external dampness. So she has occasional external dampness. So I still think spleen's fine. If we had to do something else, what's a good way to address dry in the inside, which is not changing? She's always dry on the inside. And occasionally, if we really want to address the damp on the outside, what will we supplement to do that?
Maybe lung.
Sorry?
Lung would be to supplement lung.
Right, exactly right. Right, because that would moisten on the inside and dry on the outside, which occasionally she does. I like spleen better because she's 99.99% of the time dry on the inside and dry on the outside. Occasionally she has some moisture, so that gives us some license to consider lung. She's wealthy, Dan. So does that make it more likely or less likely that we'll supplement lung?
She probably has plenty of resources, so it's probably more of a lung excess. So we probably don't need to.
I couldn't quite follow that, Dan. Could you say that again?
So if she's wealthy, she's got excess resources. Which means probably she's already lung excess.
Right.
So we don't need to supplement lung more.
Perfect, Dan. Perfect. So that's why I like spleen better. Again, since it's occasional night sweats, maybe we will do it, especially if the night sweats are more, but the resources, spleen is really perfect for most of the time. Excellent. Kate, do we ever hear why somebody wanted the stomach?
No, I haven't heard if there's anyone that wants to speak to this stomach.
Okay.
However, there's a question about consolidation. Some folks thought that kidney consolidations were only in the lower jaw.
Especially in the lower jaw. That's a great clarification. Consolidation anywhere in the body, but especially pathogenic accumulations in the lower body. That's especially where that's going to show up.
Especially in the lower jaw. And then others thought that consolidations were kidney excess.
Yeah. That's the nature of kidney. It's going to consolidate fire and water in our body. And the nature of small intestine is going to spread fire and water in our body. That's why they balance each other so well. Okay, thank you. Continue.
Yeah, I brought it in.
Oh, sorry.
You can have it before we go.
Go ahead.
Like a kidney excess?
Brain tumor?
Mm-hmm.
Could be.
Could be.
Could be anything that's over consolidated. Tumor maybe is just dampness growing. You know, it's hard for us to, we have a 400-year-old system, and to say it's cancer, it's hard to do.
Mm-hmm.
But yeah, especially cancer in the lower part of the body, like fibroids for sure, and then maybe, you know, cancerous masses in the lower abdomen. I like small intestine for that. But again, it's a little bit theoretical for me. If they're pretty and they have that, then that's more likely I'm going to use small intestine.
Okay, thank you.
Mm-hmm, you're welcome. Can you?
Do you have to be able to palpate those masses,
That's such a good point, Leslie.
the masses?
Yes, in 400 years ago in Korea, wandering monks didn't have any access to scanning equipment, so we don't know. But yeah, palpable. They were palpating the abdomen, so palpable has more weight, whereas if it just shows up on a scan, it's got less weight. But still, it's a scan showing us accumulated, so it has some weight. Yeah, some weight. But thanks for clarifying that.
I just want to clarify that symmetry is a sign of kidney excess.
Yes, they're
correct?
really into themselves, and they kind of deserve it because they're so symmetrical.
okay.
Everyone is going to be kind of into them too, like
Okay.
Angelina Jolie, right? Everyone's like, "Oh, you're so pretty," and she's like,
And
"I
she
know."
knows it. Okay.
Somebody do an internet search and find out how many kids Angelina Jolie has. Include the adopted kids. Okay. All right. What are we doing now, Leslie?
I think we covered that one, right?
Okay.
So we're ready for the next one.
Okay.
If that's what we're up to.
Ready for the next? Oh, did we look what I did? We didn't
Oh,
look. At,
let's find out what you
let's
did.
find out what I did,
Yes,
right?
Let's find out what you did.
I
I'm such a
I made the
detail
slides.
in my mind.
Okay. Okay, take this away and then this. Great. So smooth. Okay, right. So everybody and I have this amazing. Who has the microphone?
Oh
Can
my
you please
God,
read
look at
this?
her.
Can you please read this? Oh, here.
All right, so the treatment was supplementing Sanjiao on the right. The immediate response was face and eyes brighter. And after removing the needles, this self-diagnosing person said, "I feel amazing and light, like a balloon being re-inflated."
Leslie, what's the nature of this Shaoyang?
Yeah, it's just a light, that bright light that radiates
Not
outward.
every patient will tell
the
you
chest.
exactly with the Saam system, but sometimes they'll say, "I have darkness," and then you put in bright, and they say, "I feel amazing," and then she felt light, right? So this is all the nature of the Sanjiao access. So this is pretty good. Leslie, did we do anything else for this case? No, that was the whole case,
was
right?
it.
So, okay,
Done.
so again, it's so great we generated those other channels because maybe we'll see her again, but she was just happy, and then everything's resolved for her, everything's so great. So are we monetarily suffering because we just treated her for one time, Leslie?
No, she is now referring at least 8 people.
From her family,
From her
from immediate family, and everyone she knows, right? So because their darkness was plaguing her 2 years or something like that. Yeah, I think it was approximately 2
Even-
years, and that just resolved. So that's really nice, right? Psilocybin microdose didn't do it, but 4 needles did.
In a sense, a psilocybin microdose could be, I don't know, to my mind, could be acting a little bit like a small intestine treatment might, and just kind of bringing a little random chaos to break up all patterns. And
I'm not
move
sure. I'm not
things.
sure how to translate. I mean, it could be. Yeah, could be. I mean, it was helping her a little. Yeah. Okay. Kate, are we ready to take a case from the chat? Did we have anything written up there yet?
Yeah, I was gonna have them present it. Is that okay? Or?
It's better if it's written because otherwise it's. Well, I think this will work with it, as long as you write what they're saying while they say it. Is somebody who wants to present it?
Yeah, there's one person.
Okay, great.
The microphone on.
Yeah, it's right here.
Pardon my pronunciation, but Sangeeta, are you here? Oh, you are. Okay, do you want to present your case? Okay, let us turn up the volume. Hold on one second.
Okay. Sangeeta won the scholarship contest. She was the number one. We gave two. Sangeeta was number one. She made a multimedia presentation that was professional level. It was amazing. Sangeeta, thanks a lot for that video presentation. Yes, you won the contest. So thanks a lot for that. That was amazing. I was very impressed.
Oh, thank you. Thank you for having me here. I'm so grateful. I just wrote my board exam, so this is like straight out of my board exam.
Okay, great. Everyone's applauding and smiling for you. Everyone's so happy. Okay, so no results yet? You just wrote them?
Yeah. I feel like I passed, but
Everyone's very confident you got this too.
thank you. So this is a case of my dad, who I know really, really well. He's had asthma well over 30 years.
What's your dad's age?
He's about 67.
Okay.
Very severe asthma, very severe GERD, most of his life since he was around 20, and lots of stress in his life. And so he recently developed IPF, interstitial pulmonary fibrosis.
Yeah.
And his energy has dropped dramatically. I mean, he already had shortness of breath, and he has even more. He's now on oxygen. He also has a herniated stomach. So he can only eat a tiny bit of food, like a quarter of a plate of food, and then he's full and he can't eat anymore because his stomach is so full. So he is now 90 pounds.
Oh, okay.
Really thin. His skin is dry. He gets itchy generally. His skin is soft though, it's like you can lift it off his muscles. It's not. He doesn't have hard tension in his.
Sangeeta, can I ask you a question about that?
Yeah.
Is his skin dense? It doesn't sound like it's dense. It's really light and open.
Yeah, not dense. I wouldn't say dense. No. Okay, and he's always cold.
Always cold.
Always cold, and because he's also so thin, right? And he produces tons and tons of mucus. He says copious amounts in the morning, until around noon, when he can cough it all up. And he's constantly coughing now, throughout the day. And
Wet cough?
Wet meaning productive?
Meaning you can hear phlegm when he's coughing?
Yeah.
Okay.
Yeah. Wheezing, let's say he wakes up 3 times a night to go pee. Can't sleep through the entire night. He does have a prostate issue as well, inflamed prostate.
What's the prostate?
It's the inflammation in the prostate. They have him on some medication for prostate. I don't know the name of it.
Lomax?
Could be.
Okay.
He has been on prednisone forever, and anytime he gets off, he just cannot get off of prednisone. It's his lifesaver. He's been on prednisone ever since, maybe 25 years.
Wow. That's a long time. The body makes its own prednisone. It actually makes the substance. And so then, by being on it, that's tough, yeah.
Yeah. He recently went on to OFEV, which is a new drug for IPF patients, but his energy dropped dramatically. He hates this drug. And lastly, he's on pantoprazole as well because it controls the GERD from the herniated stomach.
Mm-hmm.
What's interesting about him, I don't know if you would say anything about it, he has a very large nose, and he always has had a very large nose.
Okay, good. Great, Sangeeta.
Talking about symmetry.
Yes. So it's asymmetrical. It's much bigger than the rest of his face?
Yeah.
Okay. This is a great case. I was hoping for a nice easy case, but this is a nice complicated case. So that's better challenge for the students here in person. Yeah, you can't see the students. I don't think you have a feed for the students, but it's all furrow brows as far as I can see. So this is really good, right? I've got some great ideas. We're going to put together a super group to help your dad. So is there anything else you want to tell us about that case? Otherwise, I'm going to have Dennis ask you questions.
This person has had a lot of grief and a lot of anger.
He's had a lot of anger, your father?
Most of his life, yeah.
Okay. What was your dad's profession?
He couldn't work. I mean, he worked at some college for a little while. But he couldn't work because the asthma attacks were so severe. He's been on disability his entire life.
Wow. Okay.
But
Dennis
he
is
does
gonna-
enjoy being an entrepreneur. So he does some gold jewelry fixing and stuff like that. So he loves meeting people, loves talking to people. People love him.
Oh, okay.
Kind of personality, yeah.
Is he successful with that gold entrepreneur thing?
I mean, he's okay. He does it on the side.
Okay.
Like, he gets business, yeah.
Okay, good.
It's not like, yeah, it's enough.
Great. Dennis is going to ask you some questions representing everybody else because Dennis, your dad now is Dennis's patient. So Dennis is going to, before he comes up with his 3 channels he'd like to diagnose, he's going to ask you some more questions. Dennis, go ahead.
If I'm representing everybody else, does that mean I need input from everybody else?
Okay, you can have help from Giselle also.
Giselle. Aw. Hi.
But we got to do it quick because the patient's waiting. And you guys got your second patient just arrived in the waiting room is also waiting to see you.
Okay.
Just like real clinic.
It's like diner dash.
Yeah.
I think you had a good question. That was, is the anger inward or outward?
Great.
Is the anger directed inward or is the anger directed outward?
Outward, easily irritated with people. He's very easily irritated, frustrated, yeah.
Okay.
Okay. I'm ready to treat. I've got 4 channels. What about you, Dennis? How many do you have?
Currently, I have 2 channels.
Okay, you better get that third one.
Okay. Body temperature variations.
Lots, yeah. Mostly cold though. Mostly always cold, always wearing layers, lots of layers.
Both upper body and lower body.
Yes.
Yes.
Okay, try not to repeat stuff that already happened.
Okay.
Remember, patients get irritated, right? If
They
they
are,
told you they're
particularly this guy.
always cold, right? And then you say, what about your body temperature? He's like, I told you, always cold.
Great. So my first channel, is.
Okay, wait. So you got your third channel now?
I do.
Okay, congratulations, Dennis. Excellent.
Yeah.
Good job on the hot seat.
Yeah.
Okay.
Should I confer to make sure that I'm not misrepresenting Giselle?
Ask Giselle if she has any more questions for her patient.
Giselle, do you have any more?
Sangeeta's dad. Giselle, Dennis, ask Giselle, do you have 3 channels ready to go then?
Giselle, do you have 3 channels? Giselle,
Giselle,
has
you
2.
need to ask questions. Dennis, get up, whisper in Giselle's ear your third idea.
Okay.
And if she agrees with it, then we're going to go with this case and we'll break out into groups and do it. Don't let anybody else hear. Like spinning plates and walking across a tightrope in the wind. So like whole thing's going to crash any second. Dennis, do it quickly. Giselle, do you have a third idea now?
I do. Yeah.
Okay, don't tell me what it is.
Okay.
You got it?
Okay. I'm going to give you.
No, I don't want it yet.
You don't want it yet?
Everyone break out into groups, please. And everyone will break out into groups. We'll come up with 3 channels in all of our groups. And then we'll come back and compare it. We'll come back and compare it with everybody. We're going to get Sangeeta, we've got a super group that's going to gather up and come up with some ideas to help your dad. Okay, everyone, we'll take 15 minutes for this case, and I'll break up everyone here. Kate's going to break you guys up on the live stream. Okay, Leslie, who haven't you been with? Because I lost track of all this. You haven't been with Sharon? She's right next to you. Welcome back, everybody. Hope you guys had a good discussion about Sangeeta's dad's case. Sharon, can you please tell me the team name and 3 channels you'd like to supplement this for this case, and which side? Kate's going to capture that for us. And then after that, we're going to go to the live stream after that, Kate, okay, and see what they're having to do. Go ahead, Sharon.
All right, our team name is Semantics,
Excellent.
and what we're treating. First, we came up with lung.
Supplement lung on what side?
Supplement lung on the. It's either right or left.
Leslie can help you.
Because it's lung.
Leslie can help you.
It's on the left.
It's on the left.
Okay, we're going to
Thank you,
supplement lung on the left.
On the left.
Wouldn't that be great to supplement lung on the left for supplementing lung for a male
Yeah, sure.
with a non contralateral
Oh, yes.
considered?
And
okay.
we're also treating a male anyway.
Great.
Yes. Funny how that works out. Shall I continue?
Please.
Next was to supplement pericardium
Which side, please?
on the left
Great.
because he's a male. And there are no other considerations.
Great. And your third one?
And if we had to do a third one, we decided on UB. I'm
Supplement-
sorry.
Supplement UB?
Sorry, no,
Oh.
no.
Oh, yeah, I was going to react to that.
Supplement the heart
Great. You supplement the
for
heart.
the-
And what side, please?
on the left.
Great. Kate, over on the live stream, can I get a team name, their channels, and sides, please? Pass this back to Colleen. Oh, yeah, sorry.
For the Zoom team,
Too efficient.
we have the name 40 millimeter forever.
Okay, can you get anyone involved with that team name and ask them what apps they'd like to say? And right behind Lindsay, there'll be number 2 for third app when it's released.
Good
Can
job,
you capture
Jennifer.
that for me, Kate? Thank you.
But I don't believe I'm seeing
Doesn't matter if they didn't get any channels.
if somebody in your group wants to unmute, perhaps, since I'm not seeing it in the chat, why don't you tell us what you came up with?
They literally took my recommendation to do your team name for 15 minutes. Okay, while we're waiting for that, Kate, hand the microphone to Colleen.
Isla, are you ready to speak?
We had,
Okay, great.
yeah. So we actually had supplement lung on the left
Great.
as the first, and then supplement pericardium as the second on the left also, and then supplement heart on the left also.
I didn't catch your name, who I was talking to here. Oh, hey, this is extremely rewarding as a teacher because we started off not knowing anything about the Saam system, and now we've taken a fresh case that none of us has ever seen before in our lives, and it's quite remarkable to watch you guys diagnose and treat so similarly and similar to what I would like to do for this case. So this is extremely rewarding for me, and we still have a couple more hours to go. So this is great. I'm really eager for you guys go further in the system and then start to teach me about it. So I'm really looking forward to that part. This is excellent. This is a great start.
So sorry, I'm about to disappoint you so much.
Okay, I'm a Warriors fan, so I'm used to disappointment.
40 millimeters forever.
Okay, I'm good. And the first 3 channels. Do you want to give a 4th channel?
No, so the issue was that we had I said supplement lung on the left because
Great.
that But that was not what the team agreed upon.
Okay, well, okay, was the team involved at all in the team name, or was it just all you two?
No. The 40 millimeters was definitely, I don't remember who came up with it.
Okay, that person is excellent. That person saved the class.
The person was David, but I could be wrong. I don't remember.
David Toon?
Maybe it's a Jennifer Whitney.
I was the one who was like,
was
that's our
Jennifer.
name, though.
Yeah.
No, but unfortunately for us, we agreed to supplement the stomach initially on the left.
Jacque.
And that is the opposite of supplementing the lung.
Can you say that again? I just got distracted with something.
What I was going to say is, unfortunately, we as a group had settled on supplementing the stomach.
Okay, you guys, that's a big mistake. I'm glad you kind of broke away from your group and decided to supplement the lung, because make your case for why you'd like to supplement the lung, Ayla.
The case was that there was a lot of excess in the lung, I believe. So a lot of dampness.
There's a lot of excess in the lung, so you wanted to supplement the lung?
No, supplement the stomach.
I thought you wanted to supplement the lung.
Me, myself? No. I was reading what the first group said to do when I said...
Oh, okay. So you personally wanted to supplement the stomach?
I wasn't sure, because I'm still having a hard time understanding, like, thinking of, like, all of these symptoms for the lung, I would have thought of as lung deficiency before yesterday.
No, but I think of them as lung deficiency for this case for sure. So you and I are on the same page. Maybe just flipped it. Because is he wet or dry on the inside?
Right, he's very wet on the inside.
What do you see that's very wet about him on the inside?
The coughing, the wet coughing, the wheeze.
What about his body type?
It's very dry. It's like a large intestine kind of a body.
Right. So it's possible he's dry on the inside. And where does this is such a great point for the system. Where does the phlegm reside? Is the phlegm on the inside or phlegm on the outside?
I guess because it's the lung, you could say it's on the outside.
Or we could where else could the lung be located? Where else could the phlegm be located? I'm sorry.
In the upper burner.
No, inside. So the damp could be on the phlegm, could be inside the body or outside the body. You follow me with that, okay? My teacher refused to differentiate. And so this is going to sound like a weird statement, but as a Saam practitioner, I love phlegm because this gives me license to dry on the inside or the outside. So I love phlegm.
Because it's both or neither.
We're just not quite sure where the phlegm is. Sometimes, this is from my clinical experience, not directly from my teacher, but from my clinical experience. If I hear gurgling phlegm closer to the throat when they're talking or coughing, I consider that more on the outside. And if I hear that deep, deep into the lungs, I consider that more damp on the inside. But I'll bend that in clinic if I need to. Especially the body type is more large intestine excess, so we want to supplement the spleen for him. But we have this phlegm problem, so we've got to do a wet-dry thing. So then we're trying to differentiate between supplementing stomach and supplementing lung, right?
Right.
But his inside's so dry because he's so skinny, right? Mm-hmm. So that's my case for supplementing lung. You make your case for supplementing stomach.
We would supplement the stomach because he has. So now that we've reframed the phlegm as not necessarily on the inside, and that the lung is hypofunctioning, so it would be like a deficient lung, then it would make sense to supplement the lung, and I can no longer really justify supplementing the stomach.
Great. But so leave off the hypofunctioning for that. That's a heart UB function, right? So leave off that term hypofunctioning, but it's a wet dry for sure you're doing that. But it's quite possible that if there's hypofunctioning in the lung, we might supplement the stomach or the lung, again, depending upon the body type. So supplementing the stomach can really help the lung if that's what the problem is. And supplementing the lung can really help the lung if that's what the problem is. And supplementing lung, like our case just a little bit before, can really help the stomach if that's what the problem is. Remember the 17-year-old boy with all those stomach problems? I supplemented lung for him. Again, it's two sides of the same coin. Lung, stomach is the same. So if lung is weak, by supplementing it, that's going to help the stomach.
Mm-hmm. Mm-hmm.
Okay, great. What was your second one? Can you remember, because we lost our board for...
The one was the pericardium.
Did you like that one?
Yes.
Okay, why would you like to supplement the pericardium for this case?
Because he has he has anger and irritation.
And what else is going on with his lungs that the pericardium is especially helpful for?
Good question.
Shortness of breath.
Okay.
So this is fantastic. I love this, right? So by supplementing the lung and supplementing the pericardium, we're in great shape. We're really going to go after his chief complaint, right? What was your third idea?
To supplement the heart.
Okay, and why?
Because he's very cold and he has...
Always cold, yes.
And also the frequent urination.
Yes, 3 times a night. Again, we just ignore the prostate part and focus on what's our biggest thing. Someone who's always cold and urinating 3 times a night. It's like every night he gets into the... Where are you located?
Me? New York.
Okay, like getting into New York is going into the ocean in New York every night in his body. So then he's going to pee in his wetsuit and be cold, right? Cold all the time. Great, I love it. Colleen? What was the name of your group? 3 channels in the sides, please.
Well, we're the West County Superstars because we're just that super.
I'll allow it. I'll allow it.
Right on. Okay, well, this is yeah.
It's no semantics.
That's right. I agree. You should be celebrating this.
It's no semantics.
We represent the West County.
All right. Let's move on.
All right, moving on. This is great because our conversation was stomach, and that was due to the wet cough that threw us off with the inner wanting to give him inner dryness. But we see that is the worst thing you could do for him because he is so thin.
Probably, right? Can you put the microphone to Dennis so he can answer this question? Dennis, do you love phlegm as much as I do now?
Can't get enough of it.
Thank you. Okay, now tell me about your second channel.
Pericardium.
Great.
And then the good old heart.
See how rewarding this is for a student, for a teacher that just shepherd everybody through and everyone's coming around to the same ideas that I have. It's really rewarding. It's very hard to, I told you at the very beginning, this is very ambitious to take on a complete Chinese medical system, and you guys are taking it on, and now you're diagnosing live, almost live patients. We'll do that soon. And fresh cases, you guys are all converging on the same ideas. I'm hesitant to say this, Kate, but can you type in, I'll say to them, and then everyone in the chat, put in the chat if you have any kind of curveballs that you would like to do for this. I like to generate as many good ideas as I can, especially a serious case like this. Sangeeta is definitely going to do this, our ideas, so we have to take this very serious, and we're not going to know. Remember, all my cases are all curated, and I can tell you I did this, and this is exactly what happened. We have no idea. Maybe supplementing stomach is the best channel to take for this case. I think it's really unlikely. The probability of it being stomach is really low. I think the probability of helping Sangeeta's dad with lung, pericardium, and heart, I think the probability is very high that we can really make a big impact for him. But I'm interested in any kind of curveballs. Shanna.
I have a good one, and So we had lung and pericardium also.
Great.
And then I'm not sure, I'm sort of going on a limb on my own with this one, but I was really concerned that this gentleman is down to 90 pounds.
Yes, I was concerned about that as well.
Yeah, so I'm willing to overlook some mucus because I thought I wanted to tonify spleen.
Yes.
No, supplement spleen. Sorry.
Exactly. That was a great catch. You want to supplement the spleen,
Mm-hmm.
and I think that's fantastic. I think that's an excellent fourth idea, because think about this, right? You've supplemented a lung, and you're going to be dealing with some of that phlegm, and then pericardium. You're going to deal with all that shortness of breath, and then all that cold, wet that he has from UV excess. You've done all three of those, and then maybe hit him with the spleen.
Okay.
So you've cleaned out a lot of damp pathology and boosted him up quite a bit, and then give him spleen. Remember, he's always cold too, so spleen has a little bit of warmth, and he's definitely dry aside from the phlegm.
And so I'm actually going to make an argument, now that you've given that the thumbs up, is that is advanced before heart, simply because he's also this exuberant with people. He's already has this heart outward kind of nature.
That was my super group and I. We were discussing that. We were like, but we tried to ignore that. But now that you bring it up, I think that's good. Again,
might be a toss-up at the end.
But there's reasons to not do both. There's a reason to not do spleen, phlegm, and there's a reason not to do heart.
Okay.
That's why it's so far down on our list.
Thank
Okay, but I think that's great. Sangeeta, we'll send all this to you. But anyways, that's definitely consider spleen. Yeah.
I'm sorry, what were you doing, please? Add spleen to the original brief.
Then you could consider kidney at the end to put a cherry on top.
Yeah, great. Leslie, make your case for why you want to supplement kidney in a case like this.
Well, there's some asymmetry. There's the nocturia and
The age.
the age. Yeah, and it's just it supports people in a way that just brings in this beautiful confidence and sense of self that's very grounded and resilient. It would just be a nice way to finish it off.
I love it. Okay, anybody, any curveballs from the live stream? Great. Oh, do you need a microphone? I'll bring it.
So, yeah, I think there are some thoughts about supplementing the stomach, or let me read this right. So Dan's asking about the dry, itchy skin.
Dan, that's a great thing that I think Leslie and I both forgot about. I think the skin is, again, we were talking about before, in general, wind things we like to address with small intestine, because itching we like to address because of wind things. But also, yeah, dry skin can be really irritating and cause some itching. So especially if we supplement lung, that might be able to take care of that. If that doesn't take care of that, then yeah, I'm much more cautious about supplementing kidney for itchy skin. Anything else more on the chat? We due for a break? We due for a break? Lost track.
Can I ask a question?
Yes. Figure it out for me, Leslie, if we need a break.
Okay, so I'm just curious. He has an annoyance of people, right?
No, he likes people. Or people like him.
People like him, but that he gets annoyed easily.
Yeah.
Right? And angry at people. So how are you seeing that as him showing an outward love for people? People love him. I'm just curious.
But I think we don't have, because we wanted to supplement heart, right, for him?
Yeah, I just wanted to clarify, because that was said. That
I don't understand.
I was just trying to clarify, because my understanding was that he had an anger towards people or an annoyance, but
so
then
pericardium.
Yeah.
Okay, and then something else?
But then the conversation was that he had a love for people, so I just wanted to confirm
that's the contraindication for supplementing heart, but always cold really makes us want to do that, plus peeing all the time.
Totally.
So that makes us really want to do heart, but that's why it's down on our list, because there's something there. Where I think lung is just good to go, pericardium good to go. I was making an argument to my super group, I might even start with pericardium because we're not quite sure where that phlegm is. So maybe start with PC, which has no reason not to do it, and then lung. But it's a close toggle. And then especially if we could see him in person, we would get a real sense about how irritable he is and how really dry he is. You know, we really get a sense. So in person, we make that differentiation better. But based on what Sangeeta presented with us, I still think pericardium maybe is better just because it's the cleaner way to work.
Okay.
There's no reason not to supplement pericardium for him.
Yeah. Thank you.
To Giselle.
I have a question about the fact that when he eats, he only eats a small amount.
Yes.
And I think that's why I was thinking about that there's more internal dampness. Just maybe that's my TCM lens.
No, but that could be a reason.
Yeah, so I think that mixed with the phlegm that's being
What about
coughed.
phlegm from the outside? Could that make him not want to eat too much also? Like when I've got a lot of phlegm, I don't, my appetite's low.
Yeah, I think I'm still wrapping my head around the fact that coughing up phlegm is external.
It's more, from my clinical experience, that's more external. But coughing up phlegm, sometimes I bend that and to make, I say that's internal dampness because it makes better with my theory. So that tends to, like if you bend things, I mean, the system's not just cut and dry, like I said. Inside out, we don't quite know. So we've got a little bit of wiggle room there. It's difficult when you're first learning a system. I'd like to give you more cut and dry, but I really want to give you clinical nuance. So
yeah, I think
we can bend stuff.
Okay. Yeah, I think with
damp.
that all in mind, I like the idea of supplementing PC first.
I like it a lot. I mean,
yeah.
But it's close, right?
Yeah.
It's close.
Yeah. Okay.
Great.
Thank
Really
you.
fruitful discussion.
There's a couple questions from the chat group.
Great.
Which I, by the way, named Saam Gita, but you know.
Saam Gita. Okay, that's really good.
They took it away. But anyway, let's see. So coming back to the lung supplementation, this is a statement. Now that would encourage upward movement, and he has GERD. So there's some questions here about GERD.
Right. Our super group also picked up on that right away, and we said, oh, that's one other contraindication to maybe not supplement lung. And I like Giselle's and I's idea of supplementing pericardium better. That's right. That's a good way to go.
Dan.
Way to go, Dan. That's a great consideration for that. It is ascending, and we're not quite sure where that phlegm is. So I like pericardium a little bit more. Giselle's an idea of pericardium first a little bit more.
Yeah, and there's an inquiry to kind of talk more about that upward movement. I think that's what Ayla is referring to. Is acid reflux a sign of spleen movement?
Is it?
Please.
Again, this is like that same thing of trying to understand when something.
Who is this?
Oh, this is Ayla again.
Oh, Ayla.
Sorry, I'm coming in at the end with all.
I am seeing a blank screen with your name. Did you have video?
Do you want to see my here?
Yeah. Thank you. Yeah, we got the tech. I forgot what you looked like, so now I got you again. Yes, good.
So acid reflux. So when the spleen is in excess, it ascends.
Correct.
I was wondering, I normally would not think of acid reflux as a spleen excess sign, but in this case, is it a sign of spleen excess?
If it's a sign of ascending. What about, Ayla, how many years in clinical experience do you have?
15. So
Great.
Basic questions.
Okay, no. That's perfect. This is, I'm not sure what's better. 45 years experience plus the system. That might be better, or 15 years or no experience. We have some people that are still in Chinese medical school learning the system, right? I'm not sure what's better. But I would like to marry that 15 years of clinical experience you have with the system. So you're asking perfect questions for the system. But I have a question for you to answer from your 15 years of clinical experience. Is that okay to ask you that question? Sure. In your clinical experience, what are the factors for GERD that patients have?
Like Chinese medicine factors.
Yeah.
Well, there's heat. There's
Yes.
a lot of heat in the stomach.
Yes.
I think of it.
Yep,
I think
same.
of yang rising.
So too much ascending.
Yes, too much
Okay.
ascending. And I think of not enough descending, which I guess.
Yes, I think about that too.
And I guess depending on the symptoms, it could be dry or wet. But
Yes, GERD influences that too as well. Yes.
I don't know.
Phlegm. Does phlegm ever make GERD signs in the patient?
Absolutely. Well, sometimes GERD like has a phlegm sign. Yeah.
Yeah. Okay.
Absolutely. Yeah.
Anything else from your clinical experience associated with GERD?
I mean, like glowmus. I mean, I think of it a lot in terms of like a glowmus.
So a consolidation.
Like hardness underneath. Yeah.
A density.
Mm-hmm.
So kidney excess consolidation or liver excess density.
Mm-hmm.
Okay. So again, we need to always figure out where the GERD's coming from and then treat that.
I see. Okay.
But for me, common for me is heat and ascending. That's GERD. But then a lot of other things, there's some close runners up to that.
But that's normally what I think of too, is like heat ascending. Yeah.
This 20 years, a little bit more of 20 years clinical experience, and that's you and I our clinical experience is matching, so that's great.
But so,
hold on one sec.
So then basically you don't think of acid reflux then as a sign of an over ascent of the spleen or excess. It could be.
That was one of our 5 things, is if things are ascending too much, and spleen and lung are associated with ascending. So those 2 could be excess if the problem is ascending.
And so the reason then, sorry to monopolize time, but then
no, this is key. I think everyone's really benefiting. Everyone's nodding.
Okay, so then the reason why you chose to supplement the lung is really because of his constitution, because of the dryness. You're like, oh, well, then we're not going to dry him further.
Yes. So I would like him to, my priority is for him to breathe.
Right.
And then if we make a little bit more GERD to have him breathe, I feel like that's, I mean, I always want to try and help my patients, but sometimes you have to harm a little bit.
Yeah. Okay. Getting there.
Great discussion. Really, I'm so pleased. Everyone really coming along so well. Just a couple hours, a brand new system. It's really rewarding. Thanks a lot for doing that. Anything else there?
Yeah, 2 questions from Sangeeta. One is
okay. Let's pause for a sec. Let's take a 8-minute break, and we'll do Sangeeta's 2 questions when we come back.
Okay, everyone, hear that little break right now.
Okay, great. Welcome back, everyone. I hope you had a nice break. We have a question here in person. Go ahead.
Just a quick question around like emotions like anger and fear that we talked about. If it's more of like just an acute kind of maybe like something happened and things like emotions are acutely coming up, but they're not in general like an angry person, would you still look at the gallbladder or?
Yeah, is it currently happening? I used that example before, like say female that's always cold, and then they have a high fever, and we have to supplement UV because that's presently that because of the pathogenic factors made heat excess. So yeah, if they're normally just super calm librarian, but they're really angry at something political or something, I'm trying to think of what a librarian would be upset, like something really injustice to the library budget, and they're just temporarily upset, and you see them at that moment. Yeah, that's you definitely don't want to supplement gallbladder for them because it's already out.
Okay. Thanks.
Okay, great. Shauna, do you mind reading?
I don't. For Fei Boxiong, becoming an effective physician was thus not a matter of learning a set of rules or propositions. Rather, it was a process of transformation that accepted complexity as an inevitable starting point of anything problematic, but aimed at effective action by reducing this complexity to its intrinsic dynamic.
One more time. No, because we got a second part of this, but this is I think this is just reeks of clinic to me. This quote.
For Fei Boxiong, becoming an effective physician was thus not a matter of learning a set of rules or propositions. Rather, it was a process of transformation that accepted complexity as an inevitable starting point of anything problematic, but aimed at effective action by reducing this complexity to its intrinsic dynamic.
You want to sip a tea or anything?
Let's go. Hence, to develop himself as an effective practitioner, a physician, him or herself as an effective practitioner.
Yeah, definitely make it your own.
A physician must sort through the many different doctrines and practices of the tradition and distill from them a refined essence of core principles that becomes the fulcrum from which effective action in the present can be launched.
See?
This is because the complex manifestation of a clinical problem can be understood as unfolding from a small number of quintessential life processes.
Whoa. That's such an eloquent manifestation of the Saam system from one of our contemporary physicians that doesn't practice the Psalms. But quoting Fei Boxiong, who you're not supposed to have your favorite practitioners of Chinese medicine, but every once in a while, you can't help it. Fei Boxiong for sure. He was an herbalist too, right? But he loved to do this. Like, what's the intrinsic dynamic? That's the most important thing, because there's so much complexity in clinic. We need some sturdy framework to put all this on. Only if we had the system that was able to do that. Shauna, you okay?
A 65-year-old male.
64.
64, pardon. His pulse is slightly thin, slightly deep bilaterally. We didn't look at his tongue. His face is moist with slightly bright eyes.
Give it a +2.
Okay. Prominent brow bones.
Oh, that's interesting. I don't think we've discovered that yet.
Is that a kidney kind of a thing?
We'll discuss that as we go along here.
Okay.
Prominent brow bone. Start thinking about that, everybody.
His body, he also has moist skin just all over, and he's overweight. Chief complaint is debilitating sciatica with the UB-GB channel trajectory. Status post right knee replacement 3 months ago with extreme pain, difficulty moving, unable to lift his toes at all, numbness and tingling throughout the leg. He's currently taking gabapentin and metformin.
Of course.
And his sleep is poor from pain. As an occupation, he is a cannabis sales representative.
Big one.
Oh.
Like big conglomerates. Yeah.
Okay.
I want you to see him in your mind.
Okay, great. And his health history, he has a scar. Is that what this is saying?
No, car.
Oh, a car maybe rolled over his left arm 5 years prior?
Yes, let's pause on that and I'll tell you that story. So here's this cannabis salesman guy. You got to kind of picture him with the brow bones, the prominent brow bones, and a big time salesperson, right? So he's got whole regions in the US where he does cannabis sales. Anyway, so he's working on he's got this gigantic ranch. And so he's got his shop in there where he works on his cars. So he's working on his car, the car falls off and lands on his left arm. He's by himself at that time, and he knows his friend's gonna come in 3 hours. So he just lays there with a car on his arm for 3 hours. Okay, go on.
And this situation necessitated multiple surgeries
Yes.
and skin grafts, apparently. Okay.
Can you see him in your mind?
Mm-hmm.
Okay. Do you have any questions for that case? How do you always end up with the microphone? No one's there.
Let's go to an experienced practitioner who has lots of, one of my favorites.
Dennis has been doing a lot of things, so if Dennis wants, he can pass it to somebody else.
What am I being asked to do right now, Eddie?
This is your patient. This cannabis salesperson has got significant problems, including a car on his arm for 3 hours. So,
right.
I would like to know, do you need some more information about this case before you're ready to come up with a team name?
Yeah, lots of information.
Okay, go
would be
ahead.
helpful.
Go ahead, Dennis. I'd love to. I remember this patient well. He was a character.
He was a character.
Let's go through these together. Dennis, how about that? We'll have a little bit of a framework here.
Good.
Okay, pulse slightly thin, slightly deep bilaterally. Anything else you want to know about that?
Just rate, is it, did you give a rate there?
Normal rate, say 76 beats per minute.
Okay, no, that's good.
His face, can you see him? He's got moist skin, slightly bright eyes, plus 2 out of 3, and these really prominent brow bones. Okay?
Prominent brow bone, just talking facial structure, where his eyebrows just kind of.
You know, you've seen this every once in a while. There's almost like a shelf there.
Yeah. Okay. Fair enough. Got it.
His body, when I palpate his legs and arms, really moist skin, and he's overweight. Got a belly, so you can see in his mind the whole body's a little bit overweight, but he's got that 64-year-old male belly. You know what I mean?
Mm-hmm.
Okay. The problem is this sciatica he had after this knee replacement 3 months ago. It's really painful. This is a guy that had the car on his arm for these hours, and he's complaining of leg pain now. So I think this is pretty significant. And after this surgery on the knee, I was not just a regular knee replacement, and then that was the Bing G for this case. Directly after that, he's got this debilitating sciatica on the right side only, down the back of the leg and side of the leg. Okay. He has actually difficulty moving. He cannot, when they put the toes up, dorsal flexion, whatever that toes up thing is, he can't do that. He has no control to bring the toes up. He complains of numbness and tingling throughout the whole leg. So the pain's along the channel, but the numbness and tingling is for the whole right leg. You want anything clarifying about that?
No. Temperature? Any heat or cold sensations in the sciatica?
Not on palpation.
Okay.
The skin's moist on palpation, but no real heat.
Got it.
Or cold. Meds, let's skip that. And then the sleep, let's skip that, because that's if we can get rid of the pain, sleep's going to be fine.
No bowel disturbances to speak of?
Perfect. You know what the ideal bowel movement is, according to my teacher, Dr. Angela Wu? Dennis? Did you ever study with my teacher, Dr. Wu, or do you mind if I discuss the...
Dr. Wu on Clement Street? That was your teacher?
Do you know how she describes the perfect bowel movement? Do you want to hear it?
I would say extravagant.
No, but did you want to hear it?
Yes.
Okay.
Go ahead.
Between 5 and 7 a.m., 1 to 2 pieces, banana-like consistency, light brown, floats for a few seconds and drops. So that's what he had.
Okay.
So perfect. Yeah, bowels are perfect.
Yeah.
5 to 7 a.m. Cannabis sales representative, can you see it in your mind? What type of person is a cannabis sales representative that does huge regions in the US for major ones? This is a year ago, I'm not sure exactly when this was, approximately a year ago. When cannabis was like really, everyone was jockeying for that lead position. I think it's died down now, it's too expensive. I forget, I'm not following the cannabis industry. Yeah, successful and driven, and he's getting stuff done. This cannabis sales representative is getting stuff done.
So by that description, would that qualify as outward aggression, or is outward aggression more mean-spirited and with a malicious intent, or is that outward aggressive? Can it just be being highly motivated and proactive?
Right. Yeah. I mean, as clinicians, we have to decide about that. Is it appropriately manifesting, or does he have an excess to make him do that? So I'd say he was extra salesman-y.
Competitive.
Mm-hmm.
Okay.
Anything else about this car? I don't have much to add to that, right? He just calmly told me the story. And this arm is messed up, right? So I should give you that kind of surgical scars where it's this way and that way and this way and that way, and then the next surgeon comes along and it's a little this way, that way, this way, that way, slicing and dicing. So this arm's pretty messed up, but he can kind of use it, and it's patchy from the skin graft. So like there's little like different colored skin at different places. This whole is the left arm, right? Yeah, the whole left arm is like a patchwork of skin from other areas and scars.
So he has limited strength, limited range of motion, pain?
No.
Okay. All right.
Dennis, do you feel like you're ready to diagnose this case?
I'm willing to, I feel like I'm ready to give it a shot.
Great. Somebody else had a question, Anita? And then up to...
Is this knee surgery was on the same site as the sciatica pain? Also on
yes, he had the right knee replaced, and then he has right urinary bladder and gallbladder channel pain. Mm-hmm. And the whole leg is numb, and he can't do the toes.
Thank you.
Mm-hmm. Oh, sure.
And how far up the UB channel does the pain start?
What was your number 2 ice cream flavor that you loved in Double Rainbow?
French vanilla.
Yeah, I tried to knock that out. I couldn't. You know where the
can't.
Do you know where the vanilla?
Best.
Do you know where the vanilla came from? Do you remember?
Was it Madagascar?
Yes, it was so expensive. And when that came into the warehouse, everyone went into the warehouse and was like, "Oh, that's the smell of heaven." Okay, good call on number 2. What was your question? I forgot it now.
How far up the UB channel does the pain
up into
start?
like the back?
Like
yeah,
into lumbar?
Yeah, just barely, and then
Okay.
gallbladder just barely here.
And what's his voice?
Clearly, like he could tell me, oh, I can feel the pain right through here, and
Okay.
oh, I can feel the pain right through here. You know, so he
Tracing the
yeah, it was great. You know,
meridians,
so
yeah.
I'm really confident to present to you the channels. He, not knowing anything about acupuncture, he's like, yeah, I
Yeah.
can hear, and then
Textbook.
yeah,
And then what was his voice like?
really loud.
Okay. And are you able to, does he have so many scars on the left that you would not be able to needle through them?
That's going to be a factor for us. I wasn't sure, but we're going to test your idea. So make your decision now, write on your piece of paper, will I needle that arm or not needle that arm? And then make a decision and circle it, because I do make a decision and do it. I just wanted to see if you and I have a similar idea.
Okay. Those are my questions. Thank you.
Great. Yeah, great questions. Anybody else, any questions? Live stream, any questions? Great. Live stream's ready to diagnose. I'm talking to you, David Toon. David Toon, you ready to diagnose? Tell in the chat if you're ready to diagnose. Okay. David, is there any questions that you would like to, I don't need this. David, is there any questions that you would like to ask so you're ready to diagnose? And also, you got like a real high water mark here with the Saam team name with semantics. I really like that. So you got to kind of up your, so if you're not going to come up with 3 channels, then you got to at least have a good name. So are you ready with either of those 2 things?
Oh, like right now, or do we get some time to discuss
Right
first?
now, right now, because I'm about to give you a couple minutes to work on that, but I want to know if you've got 3 good ideas and a good channel, a good team name.
Okay.
What about you, David Seto? Apologize if I'm not saying that name properly. Maybe on break. If you're on break, that's okay, David. What about you, Eartha? Okay, maybe everyone on break. Okay, and we're all good here with questions and everything? You guys are ready to diagnose and treat? Great. 15-minute breakout rooms, please. 15 minutes here. Okay, great. Welcome back, everybody, and I hope you had a really fruitful discussion of our cannabis salesperson. We're going to start with the live stream, and so Kate's going to manage that on the live stream. I'm really curious about how you guys are doing live stream wise. Name, channels, and everything like that, and sides, please. And especially David Seto, if I'm pronouncing your name right. I know we haven't interacted yet, but I'd really like to know if you could either reach out to Kate or unmute and turn on your video so we can talk to you. Sanjo Access trying to hide the whole class, but I don't allow it, Colleen. I don't allow it. I don't allow someone doing what I would like to do. Okay, Jennifer Whitney, do you mind putting your camera back on? It's just a glimpse of you. Hey, Jennifer, are you up for it? Okay, this I like to hide too in class too, so I'm coaxing you back out. Do you mind telling us your team name and channels and sides, please?
We didn't really get to a new team name, so I think
that's a top priority. Have you not been paying attention the entire weekend? I tell the students that the top priority is the team name.
Right. So I think because we had such an awesome team name, the 40 millimeters forever.
All right.
To keep rolling with that one.
Evoking that, I didn't realize, I forgot about that part on our charter. That we can evoke the previous name if it's stellar. So okay, yes. Go ahead. Let's move on to your channels then, please.
Okay. I'm going to ask for my teammates to chime in if need be. So we were thinking to start out with tonifying the small intestine, supplementing the small intestine.
Great.
To really get at that pain.
Yes.
As soon as possible.
Can you pause just for a second?
Yeah.
So always when I see surgery, I always think of what?
Scar tissue.
Yeah, but what do I think about in Chinese medicine terms? Jennifer? Everyone told you that if you were in person, you would have had the answer right now because everyone said the same thing.
Well, blood stasis.
Yeah, that's exactly what you and I thought of the exact same thing. A whole bunch of scars, and we think all that surgery, there must be tons of blood stasis there. Multiple, I mean, it looks like somebody else's arm on there. So I thought, okay, blood stasis. So I'm bringing that point up because I also think supplementing small intestine is a great idea. I'm on team small intestine with you. Good. Anything else? Any other rationale for supplementing small intestine for him?
Well, we were talking a little bit about like to be such an impressive cannabis salesperson, he might be fairly narcissistic.
Yes, he is. I mean, this is palpable in the room with him. It's about him. Yes, great. Good intuition. We're going to get to the brow. Oh, hold on a second, Jennifer. Just pause for a sec. Can you pass the microphone to Sarah? Sarah, how could the small intestine or kidney dynamic be associated with the brow?
To me, I mean, it just seems like maybe they're very like intellectual and into themselves. I'm just guessing. I don't know about the brow. Sorry.
I think that there's a much more plausible channel associated with the brows.
Okay.
You want to take a stab at it, or?
I'll wait.
Okay, we're gonna wait. Jennifer, go.
So then the next thing that we talked about was supplementing the pericardium.
Great. Make your case.
The channel trajectory.
Yes.
Of the sciatica.
And then you got your sense about him. He is aggressive in his sales, right?
Yeah. Yes. Okay. Also.
Do you want to talk about the brow bones at this point, or you want to go into some other channels before we talk about the brow bones?
Well, I had a lot of thoughts about brow bones, some of which I don't know if they come up. You know, I don't know where the strong bones come in the Saam system, but
intestine.
Okay, so yeah, was thinking about large intestine. Wasn't sure if the TCM Kidney Association carried into the Saam.
If it's from the Neijing, you can consider it.
Okay. Yeah, that's
okay. But let's talk about besides just specifically the brow bones are big. So do we have any in the Saam system? Do we have anything that's concave and convex in the Saam system that has a channel that goes right through there? Jennifer.
Yeah, well, the gallbladder is
so that for me, I find this highly correlated with gallbladder excess when these brow bones are out there. And then every male you see that's hyper aggressive, look at their brow bone because they're just popping out there. I was telling my super group I was in that there's some kind of study, everybody in prison has got prominent brow bones. So to go to prison, you got to be aggressive, to go steal money, kill someone or something like that. So that makes it, we would predict that with the Saam system, those brow bones being really prominent. And so this guy he channeled it into business rather than crime. Although look at this, it's slightly crime.
The two are not very far from each other in a lot
just a few years ago, this was a criminal enterprise. And since he'd gone on the ground floor of that, he probably was doing something.
Right. He didn't grow those brow bones overnight.
Jennifer, everyone's chuckling here, and I don't like that when it's not. I haven't made the joke. Okay. Well, again, because of our charter, and then if you have a good team name and you don't have a second team name, you can have one chuckle. But that's it, Jennifer. You're on thin ice. We're about to cut your feed. Kate will just cut your feed.
Okay, I will be completely serious.
Okay. Yeah, we're about to cut your feed. I didn't even know if we could do it. I thought it was an empty threat, but it's a real threat, Jennifer.
All right. And so then our next piece was to supplement the large intestine.
Great. Make your case for that. I'm really happy, Jennifer.
So he's got dampness on the outside and on the inside.
Yes.
He's overweight.
Yes, he's got a big belly.
And then he's also got numbness.
Yes. Where's the numbness? Is it a little patch of numbness or is it the entire right leg?
The entire leg.
That's a lot of damp, right? The entire right leg you can't feel? Wow. Okay. So great. Yeah. I love it. Did you come up with, that's 3, right? Did you come up with a 4th?
No.
Okay, great. I'm extremely,
I mean, I guess
I've gotten over that you didn't have a team name because I'm so happy about your channels.
I guess the 4th, we kind of talked about it, but we didn't agree. We didn't really have time. But maybe tonifying the lung because he's got this right-sided pathology, also numbness, also weak knees. Yeah. But then maybe the knees weren't weak. We don't know why he had that surgery.
Remember, the weak knees has to come after losing money for a long time. So just be careful about that.
Okay.
Paired together. So it's not just weak knees in general. It's a triad there. Losing money for a long time, weak knees, and it has to sit. Wait till you see this, Jennifer. The patients tell you this, and you're gonna be like, lay down. My needle finger's getting itchy.
Cool. Okay, I didn't understand that was.
That's a really odd triad. So I want to, that's important to clear that up.
Thank you.
All right, so great. But so I don't really like lung that much for that because especially with that big belly, I don't really want to add to that big belly. And people that got on the ground floor of cannabis thing that have huge regions of the US, do they tend to have resources? Jennifer?
Sorry, somebody's just chatting at me and being
I'm sorry.
But I don't want to get in trouble for making another joke. So
okay, that's good. That I appreciate that kind of caution, Jennifer. And you're making a joke that's cracking people up here about not joking. So, Kate, let's cut. No, Kate.
No, that means an app for me, right?
That means an app.
Now everyone's really laughing. It's full-throated laughter here now. If it wasn't a good name, Kate, I would cut her now. Okay, Jennifer. I think your idea of supplementing lung is horrible. Not really, but now I feel like I have to punish you for something. No, so anyway, so this is so great, right? So I think he's really wealthy, he really seems like it, so I think lung's not good. That gigantic belly, if you could see it, you definitely wouldn't want to add damp to it. And that numbness, do you really want to add some numbness or some dampness to the leg that's all the way covered?
All right.
Okay. Yeah, but so anyways, great. And I love this. Again, the first couple of channels get easy, and those are the ones you're going to do anyways. But it's nice to just generate ideas and think about it. These have been, I think we're not going to have time to get to it today. I gave us 20 case studies because I overthought it and got too over-prepared. So we're not going to get to this one, but one case, I saw the patient and I wrote down my 3 ideas, and then it ended up really saving me at the end. Okay, so it's really worth it to get a 4th idea and maybe even a 5th idea. So great. Anything else you want to add, Jennifer, that's not funny in any way?
I only have a funny thing. It's an updated teammate.
Go ahead, Jennifer.
So one of my co-conspirators just upped my suggestion of 40 millimeters for.
I'm ready because my energy is flagging, so I'm ready.
Okay, so Dan suggested 50 millimeter, even better.
Okay, great. Acceptable. You're going to end up with some CUs after all, because I was about to cut those next. Okay, great. Let's see about people in here. Where's our microphone? Sarah, do you want to represent your group?
We had the same.
Oh, great. That's great, because we'll streamline this. That's a really important point. Anybody have something that Jennifer didn't have? Yes. Can you pass to Leslie, please?
We just had a 4th potential, which was UB.
Great. Can you make your case for UB?
The pain is on the UB line.
Yes.
And there's nothing, that would contraindicate it, even though.
I can think of something.
What's that? Oh, the moisture.
The moisture is a slight caution, but definitely not a contraindication. But there's definitely a hypofunctioning happening here. Do you remember what he can do with his toes or can't do with his toes?
Oh, he can't lift them up.
Yeah, so in general, if you can't lift the toes, I don't want to freeze them. I'd much rather warm them up and get some hyperfunction.
So you're looking at heart then instead.
I would definitely consider heart. I can't remember what I did, but I would consider more heart for that to deal with that UB channel pain.
Great.
But again, it's slight, there's no real hot cold presentation for him that I gave you and that I can remember. So especially when you're not sure hot cold, then we look at something else like hyperfunctioning or hypofunctioning, and all those toes are extreme hypofunctioning. This Leslie, for stroke patients, Billy and I saw one of these too. Supplementing heart tends to be really good for stroke patients because that's whole side of the body hypofunctioning, not just the toes, sometimes arm, leg, everything like that. I have a quadriplegic patient too, also supplementing heart's really good because that's extreme hypofunctioning of all the limbs.
And in those cases, you're still looking for some kind of a cold sign.
Yeah, but hypofunctioning itself is cold.
Is the cold sign.
Is
so
the
it's
cold sign, but
not,
if they're always cold plus hypofunctioning, then yeah, we don't even hesitate.
if there's a warm, I just saw somebody actually in a wheelchair and I was just thinking about this, but I palpated their midline and it was soft and warm, but they still complain of cold sometimes, but then their feet, when they get their husband puts all the blankets on them and then their feet start feeling like they're moving on the inside and they ask for the blankets off their feet.
I'm so glad you brought up this case because we didn't take it all this weekend and we're running out of time. If it's mixed like that, move on to some other channels.
Yeah, fabulous.
Okay. Yeah, Colleen, can you pass to Colleen, please?
I'm just curious if you can remind me, I feel like I've heard you say that when there's sciatic pain that's coming from the SI joint, like from the sacrum there, that you typically supplement SI, even though it might still be on the UB channel. I'm just wondering.
Yeah, I mean, the small intestine shoe point's right there.
Okay.
So for sure I'd consider that. He has, I would consider that, but the pain's really got to be really there.
Okay.
And then we have something else too, but it's really got to be prominent there in the SI shoe point.
So
UB 28, right, students?
Yeah. So in this case, with the sciatica, you're looking more at the pericardium, supplementing the pericardium to target the sciatica.
He traced the gallbladder channel for me. It's like right there,
awesome.
Right there.
Okay. And then SI because of the overall pain.
Yeah, overall pain, and then also the patchwork arm.
Right.
from multiple surgeries. And after knee surgery, the Bing G was the slicing and dicing, making blood stasis and having a lot of pain. So yeah, I like your idea of small intestine a lot.
Question in the chat about the heart shoe and asking if it would be reasonable option as it works both the heart and the UB as a balancing.
The heart shoe point?
Yeah, Dan, do you want to?
Oh yeah, Dan, please unmute and
talk about that?
I'll talk to you.
Yeah, I thought in our conversation yesterday, and we talked about the shoe points. I thought I heard you say that the shoe points would work both of the related channels kind of in a balanced way. So they're saying we don't want to use UB because it might be too cold. Heart might be an option. I was thinking, well, you know, if we don't want to add a lot of heat or we don't want to add a lot of cold, but we want to activate those systems, would the shoe be a reasonable option, as it might
you would needle the heart
in
shoe
UB,
point,
but not put a lot of heat or a lot of cold into the system?
Dan, you would needle the heart shoe point?
Yeah, that's what I was thinking.
So this tradition, we don't do that.
Okay.
But we look for problems at the shoe point and then treat them with our regular channels.
Got it. Okay, thank you.
Why is the heart and UB not a big factor for me, those heart and UB shoe points?
Why are they not a big factor for you?
Yeah, mostly I really, the other shoe points are so valuable for me. The heart and UB shoe points aren't that important to me. Why?
Not sure.
Because the heart and UB already do the whole UB channel.
Okay.
Right. So that they're already embedded in that idea.
Right. Okay. Yeah.
Yeah. Good. Thank you, Dan. Anybody else here? Anything? Otherwise, I'm eager to get going with our case. Can we go back to the great, Kevin? This is awesome. Just like rehearsals, Kevin. That was on me. That was on me. Oh no, that's on you now because mine's up. Okay. All right. Who has the microphone, please? Can you read this, Kate?
Male. G is the name. First treatment, supplement small intestine on the left.
Colleen's idea.
Immediate results.
Nice work, Colleen. Where is she? Oh.
Include lifting the toes.
Oh, that's pretty good.
Numbness resolved.
Oh, nice work, Colleen. Numbness resolved.
Pain is greatly reduced.
So this I would like to treat, right, as soon as possible, this kind of thing, right? So, not the next day, but 3 days later.
After 3 days, numbness returned a little, 20%. After 5 days, pain concentrating in gallbladder channel, redwoods.
Okay. This is because now I want to now treat again. Kate, have you been doing the chat or following this case at all?
Yes.
Have you been following this case at all, or are you just mostly doing the chat?
A little of both.
Do you want to, what should we do now? Because now we have that new situation.
With the pain concentrating in the gallbladder channel?
And the numbness coming back?
And the numbness. Probably something with the liver. So we're going to balance that by, in the second treatment, supplementing the pericardium on the left. And we see immediate results, the pain greatly reduced. After 19 days, continued improvement with toes and gallbladder channel. Some numbness remains on medial side of the right big toe.
What are we going to do now? Kate?
I'm thinking. We want to take care of that numbness.
Yes, and especially since it's on the medial side of the right big toe. Do we have any channels that does especially good, deals with numbness?
Maybe the spleen and that dampness.
Exactly. So we supplement LI.
Third treatment.
Oh, okay. So this is what I really want to say, because somebody else had the same idea as me, right? we're going to supplement LI on the left, right? Because we're going to needle into that crushed, massively destroyed arm and wrist. The whole thing's just one big mess, the whole thing. And I was like, guess what channel was still functional there?
Was it the large intestine?
Yeah.
Just
So look at this immediate. So by immediately result, because again, we have so many 10,000 things they could experience in clinic. And so I never had someone with a car on their arm for several hours and then multiple surgeries. And I was like, I wonder if the channel system's still there. Apparently, because the numbness is immediately reduced and then long-term all symptoms resolved. That's pretty good, right? So that was 3 treatments. It's not bad, huh? It's a good system.
It's a great system.
Okay. Let's take a break. And then we'll come back and did everyone that wants to be treated put their name in the jar? If not, then just put your name in the jar. And then Lucky Kate will pick a lucky name in there and we will do treatment. So Kevin, when we come back, it'll just be Leslie and I interviewing whoever wants to get a treatment. And then we'll maybe take a quick break and then we'll set everything up. Okay, everyone, 8-minute break, please. Is this on? Okay, great. I say to my patients, if time and finances allow, try and come every day or every other day. And so with her dad, I imagine she's not charging, so that's finances out of the way. And then just time. If her dad can spare the time and she can spare the time, then every day, every other day. I'll sit so you have it. Oh, damn it, you guys. I think we'd have that. Can you pass this, Sharon? Okay, I'll start talking and then Leslie will talk to you. Then when Leslie, yeah, but you and I will talk first, okay?
Okay.
Great. Welcome back, everyone. We did off camera. We figured out who the next person was that is going to be treated, and it's Giselle. And so she's agreed to. Leslie and I are going to conduct a joint interview and see if we can come up with 3 channels to supplement for her. And then we'll have to take a little bit of a break as we set up the table and get the cameras ready and everything like that. But we're going to start with the diagnosis now. Kate, if anybody on the chat wants to ask any questions, why don't you capture that at the end of our interview? We'll grab that. Everyone live, no more questions. We're going to try and make this quick, okay? So just live chat, live stream, we'll be able to do it. Leslie and I hopefully cover all your questions here in person. Okay. Giselle, thanks so much. Thanks for coming into the clinic. What can we do for you?
I think I have 2 things that have shifted recently. One main thing is my digestion. It's felt very off, I would say, for the last 3 weeks.
What kind of things are happening?
I would say chronically I tend towards constipation.
That's not in the last 3 weeks?
No, and then the last 3, lifelong, kind of alternating between constipation, or tending towards constipation.
Yeah, normal bowel movement and constipation, you go back and forth? Mm-hmm. Okay.
And then starting the last 3 weeks ago, I had about a week of diarrhea, which is very abnormal for me.
What was going on with you 3 weeks ago?
I will say there was some intense family stuff that I was dealing with.
I should tell you something because it's not just you and I in the clinic where it's HIPAA and everything like that. So it's you and I in the world with this right now. So anything you want to not discuss, then you just say, oh, it's your prerogative in this situation, right? You just say, oh, I won't discuss that. And any questions I have or Leslie has or the chat has, you can refuse to answer.
Okay.
Yeah, because we are to protect your privacy. So I want to ask you a question about that. Was there a theme to that family stress?
3 weeks ago, there's a lot of anger.
Okay. Directed at you or from you?
Coming from deep within me. and coming out.
Was it the anger was going to other people or yourself?
Other people.
Okay. Anything else going on at that time?
Nothing big, nothing abnormal. Yeah.
Maybe the disease trigger then. Okay, great. That's really valuable for us.
Mm-hmm.
You look so healthy otherwise. Is there anything else?
Yeah, I've noticed my skin has been acting funny, like strange eruptions of pimples.
I see a little bit just on your cheeks here.
Yeah, and I've had one in my ear.
So you're having convex manifestations?
That's been there, and it's lingering much longer than I would expect.
That's interesting. Is that in the last 3 weeks too, or before? That's interesting, right?
But chronically, I would say I have acne. It's been on and off a problem for me.
Where?
Usually on my face, like around jawline.
Jawline looks clean right now, just cheeks I can see. Okay. Anything else you want to
say?
Yeah,
I have one also like right here. That popped up in the last 2 days.
That's interesting. Leslie, can you get up and look where that, and then just tell what channel that's on?
I don't know.
Kidney. It looks kidney to me.
Yeah, kidney, right.
Yeah, so those are the main things, but I think my digestion has felt off for 3 weeks, which is a long time.
Yeah. And it went off and then stayed off, or is it getting any better or worse?
I think after the week of diarrhea, I wasn't going for a few days, but then when I would have a bowel movement, it was like big and a damp type of bowel movement.
Okay.
Very sticky.
Great. Oh, yeah, I really appreciate that. Like, as clinicians, we could just talk about this. Like, we talk about this all day long. So I really appreciate you being really clear about that. That's so valuable for us, right? Sometimes I ask patients, "Oh, how about your bowel movement?" They don't know what it looks like, how often it is. They just can't think about that kind of. So, especially more information, the better.
Yeah, I can be.
My
clear
teacher,
about
Dr. Wu, who is really into bowel movements, I told you about the perfect bowel movement. She also said she called it the report card.
The report card bowel movement?
Well, the bowel movement itself is a report card, what's happening inside the body. We get a report card every day, how everything's going. So I like that idea too, right?
Yeah.
Inside's being reflected on the outside, so that's always diagnostic for us.
Yeah, the bowel movement that you described earlier today, but your teacher described the perfect bowel movement. I feel like I can count on one hand how many times I've had a bowel movement like that. So
okay, well,
digestion's always been.
We may be able to come up with 4 needles that might be able to help you get that perfect bowel movement. That'd be great. Yeah, you can put that on your website. Perfect bowel movement from this practitioner.
Okay, I'm ready.
Anything else you want us to look at today?
I think those are.
I'm ready to diagnose and treat. I've got my 3 channels. What about you?
I was wondering, any aches and pains anywhere?
A little bit in my hip, right hip.
Gallbladder channel?
Channel, yeah.
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 Say for sure, gallbladder channel, or is it diffuse? Too diffuse to say?
Gallbladder channel.
Okay.
Yeah.
Leslie, is her voice soft or loud?
I think it's not soft.
Yeah.
It's not so loud that
A little bit.
But yeah.
Yeah.
Yeah, now it's soft.
She modulated. What about her voice? Does it have a slight huskiness to it?
Yes, it does.
Yeah, I think so too. Anyone ever say that to you? Your voice is a little husky?
Not really.
Okay, yeah. It sounds like a little husky. Just it's minor, but that's what I'm getting from her so far. She's definitely got. She can get volume if she needs to, and slight husky. Husky. This is for a Saam characteristic of kidney excess. There's husky. And the huskiness increases. If they get sexually aroused, the voice gets even actually huskier.
General.
Let's keep it professional, Kevin.
General body temperature.
It's been a change for me in the last 3 months. Oh, I don't know if you want me to talk into here.
Oh, yeah, thank you. Nice awareness.
It's been a change for me in the past 3 months or so, where I used to have very cold hands, and now I feel like they're very warm. It's something I've noticed as a practitioner in the clinic. Like colleagues are always like, I'm sorry, my hands are so cold. And I'm like,
It's horrible to do that to the patient.
Mine feel really good.
I know, but if you have cold hands, you have to have warm hands somehow. You put warmers in your lab coat, you do hot water. You can't touch the patient with cold hands. It's unacceptable. You need to care for the patient, so you can't harm them with the cold hands. So I'm glad yours changed. What happened 3 months ago?
Well, I think I've been working with an acupuncturist on constitutional stuff. Nothing major, but I think working with her has helped my body temperature regulation a bit.
Great.
So that's, I don't think any big shifts besides that.
Great.
Yeah.
What about your feet? Do they tend to get cold too?
Yeah, I feel like I tend to need to have socks on.
Okay.
Yeah, like right now they're pretty cold, even though I don't feel like I need to put socks on now.
The wind
but
too, though.
Yeah.
The wind is a factor.
Yeah.
Okay.
My feet tend to still stay cold though.
Okay. Great.
How do you feel about sweets?
I love sweets.
Oh, we capture it.
I love sweets. I also do love salty though. I love.
Okay.
Yeah.
How many scones did you eat yesterday?
I ate one full cherry scone.
Okay. Oh. Good call on the cherry. Okay, good. All right. You ready to diagnose?
Yes.
Okay, great. I need questions for Giselle from the chat. And then remember, you just refuse anything that you don't want. Oh, give it to me.
Yes, good.
Oh, what's your age, Giselle?
I'm 32.
How are your menstrual cycles? If you're comfortable.
I'm comfortable. Yeah, thank you. My menstrual cycles are very regular, every 28 days. Ovulation is also regular. I tend to have very phlegmy blood, is the way that I describe it.
Oh, that's valuable for us. Yeah.
Yes, so it's like this substance. You know, it's not dripping. It's not necessary. Sometimes there's clots, but it's just this like phlegmy substance. Yeah.
Again, females have this second report card. It's so great.
Yes.
Every month you get that report card. So great.
I will say that this past cycle, which I'm just ending now, PMS symptoms were very extreme, and they haven't been like that the past 6 months or so.
That was
and I
that
think
was
it's
after the
correlated.
3 week. Yeah. Okay.
Yeah. Yeah.
Okay. Great. The great chat questions. Any more chat questions? Do you experience any bloating?
Yes, I feel like I'm experiencing it now.
do you mind standing up and showing us where you're feeling the bloating?
Sure. Right here.
Yeah. we can see.
Yeah, you can see it.
Not normally like that. You're.
Well, I would say in the last 6 months I've noticed weight gain, and I haven't changed anything about with the way I eat or the way I'm exercising. I feel like I'm relatively active.
What type of exercise do you do?
A lot of hiking. I have a pretty active dog, so we get out all the time.
Great. Okay, great. I'll answer that for her. Pretty. And then eyes.
Symmetrical.
Yeah, very symmetrical. Eyes +1 brightness. It's kind of hard to see with this outdoor light. Leslie, how many you think dull?
So thank you. So when we first sat down, I had the eyes slightly dull, just not deeply dull,
same.
but slightly dull. And then as we began talking, and you began telling me about sweets, they brightened right up.
That's diagnostic for us, great.
And then they were like a plus, to my mind, like a +3 in that moment.
Yeah.
So then with the cold,
Yeah, so I think it's fantastic. And so also, damp is not going to instantly shift, but bright eyes, dull, that can switch around and everything like that. So again, it's mixed a little bit for her, so we won't put too much weight in either one.
Yeah, I'll add that. When I first came up here, I have a little bit of stage fright, and Yeah, I get my heart races when I'm up in front of people and talking.
Welcome to my world.
So that was what I was feeling when I first sat down here.
Okay, yeah.
And I don't feel that as much right now.
We would say that that's healthy liver, right, came up to shield her from this this situation. Good, so appropriate protection.
Okay.
Anything else from the chat? I'll allow one question if anyone has a burning question in person. Okay. Everyone, let's break it into our groups. We'll take 15 minutes to discuss it. We'll come back, and then whatever the top idea is, I have veto power, but probably I'll do the top idea that everyone comes up with. If this is totally wrong, I won't do. But,
thank you.
Yeah. Okay. 15 minutes, everyone, work on break. Hi, everybody. I hope you had a good discussion on Giselle's case. We have a little bit of new information that may alter what's going on with your diagnosis. And I was about to say here, I just didn't realize that we weren't patched in yet. I was about to say, and I'll say here now, that I never make my final decision on what channel I'm going to supplement until I insert the first needle. So I'm just waiting, and I never decide until I'm about to put that first needle in, because countless times I'm about to put that first needle and the patient suddenly says something, or I see something, or something that triggers it. So I just try and stay open from as soon as I meet the patient all the way through the diagnosis. I already have my 3 channels, but then I'm always waiting for, something else that might come up. Something about, I'm about to needle, I'm about to put this quality in their body. Something about that makes it so it elicits something from the body. So a lot of times these last minute things that pop up are really valuable. I think that may have happened here, but we'll see, because Leslie was paired with Giselle. And so
Yes.
what did you guys?
Had a little bit of new information. The quality of the anger, it had some grief in it, and it had to do with an obligation to do a lot of work, to cover somebody else, where there's no real recompense for the work, and it doesn't look like it's going to stop.
Okay.
Also that there's some dry, itchy scalp with larger flakes that were larger and itchier the last 2 weeks. And that she's been fatigued for quite some time.
Okay, that's great. A little bit more valuable information. So, Kate, can you pick somebody from the live stream, please, that is got a video on that I can talk to? Hey, David.
Yeah, hi.
I heard you, and I'm just, hey, David.
Hello.
Good to see you. David, what was your team name, 3 channels that you'd like to do for Giselle?
All right, so our team name, and we're learning it's most important. Since we're all sitting at home in the dark and indoors, y'all are outside. Our team name is Let the Saam Shine In.
Excellent.
Okay, so I got that out of the way. We'll get to the.
All right, yeah, that's good. Most important thing now. Do you have anything else that might help this patient?
Oh, just you want our treatment thoughts, or
please?
Oh yeah. So we're looking at basically first was spleen excess, and therefore we were
just to make it streamlined. Just tell me what channels you want to supplement and the size.
Yeah. Sure. Supplement large intestine fur.
Great.
And then we were thinking of supplementing.
Pause for a second, David.
Yeah.
What about that new information that we just got? Does that make you pause at all for your top channel?
Yes.
Yeah.
David, your voice changed. So anyways, remember we had that drive.
Actually, I didn't. Can you repeat what the new information was?
Yes, Leslie.
I think we were.
There is a dry, flaky scalp that's been itchier and drier the last 2 weeks.
Really big dry flakes.
There's been a history of fatigue, and the quality of the anger, it lasted only an hour. It had grief associated with it, and it was a sense of having to cover someone and do work that wasn't really going to be recompensed or really resolved.
Okay, got it.
Did that change your top idea at all? Do you have any caution for that?
I mean, basically, if the grief is still there, then that that might be the thing that we really need to focus on. But, moving to our second one, the second one I think we were looking at was treating the pericardium.
Mm-hmm. Those points are painful. David, are you sure you want to do that to Giselle?
I don't know if it'll make her feel better.
Yeah, that's my feeling too. This is what I say to the patients. Sorry, we have to go through a couple of thorns to get to these really big fruits.
Yeah, nice. Yeah, I mean, if it's what she needs.
Yeah.
Yeah.
Third idea?
Well, I mean, so now I'll let the group jump in, but basically, I mean, if the grief is still a big deal,
mm-hmm.
Then I would, possibly look at, treating the stomach.
Great. Can you tell me your logic by dealing with the grief to deal with the stomach? I mean, I love it.
Yeah,
I just love to hear your logic.
Yeah. I mean, so if the grief is really, in excess, and that's really consuming and controlling, then that's in excess. And so the stomach, will basically, the stomach then has to be in deficiency. So, if you want to help them move past the grief, you need to bolster the stomach to balance out the grief, or which is grief, sorrow, metal, lungs.
Yeah. Do you mind if I rephrase it and then tell me if it's right? What you just said. Do you mind?
Oh, not at all.
Okay. So what you're saying is the classical reference from the Neijing, grief being associated with the lung. We're going to import that into the Saam system, and then we're going to use that grief because it's associated with the lung. For the Saam system, that means lung stomach, right? We don't know anything because it's associated with the lung, but we don't know anything. But we have a patient that has a little bit of damp accumulating inside their body and some dry, flaky skin also happening at the same time. So by supplementing stomach, that would be the perfect thing to deal with that grief and match the body type pretty perfectly. Do you mind if I rephrased it like that? Is that correct?
No, I think that's brilliant. Thank you.
Okay, thanks for saying that.
Yeah.
Let's make sure David gets, he said my rephrasing was brilliant, so let's make sure he gets CUs. Okay, Kate? Everybody else, hit or miss on the CUs, but we're going to make sure you get the first CUs. Okay, any other feedback from your live stream fellow people?
Does anyone else have anything else? Anyone else have anything? Yeah, we were also looking at possibly, later on, looking at some of the treating the small intestine if the pain didn't resolve, basically.
Right. Why am I having like a little bit of? She's definitely pretty, but why do I have a hesitance to supplement small intestine? And I'll answer my own question. Right, her menstrual cycle is unusually good. Right, so there didn't seem to be any blood stasis there. It seemed to be there was some dampness in the menstrual cycle. So if we say that dampness is coming from the inside, and we already have that idea of supplementing the stomach, that might be a really good way to deal with that, right?
Okay.
Remember, we do have that one pimple on the kidney channel, so that's another reason to maybe do small intestine. Can you tell how symmetrical she is with the camera work, or is it hard for you to see?
It was hard. We just had to take people's word for it, but the word we got was symmetrical.
If she's okay with it, we're gonna, you'll be able to really see when she comes for her treatment. You'll be able to really see her face. But then look at that too. You can really see her symmetry when she does that. We have more of a look close up on her face. Okay.
And then the husky voice also tied into that.
Yeah, it was significant. Her voice is husky. No one else had ever told her that before, but for me, it caught my attention, so that's good. David, I wanted to say one more thing. I can't believe I haven't said it yet. For the Saam system, I always talk about, things gross or subtle, and then we have like a term that we use called grossest thing in the room. So something that really catches your attention, especially unique about her, is symmetry. We'll have grossest thing usually, but we do things. She's got great symmetry and she has that husky voice. So I'm back to your idea of supplementing small intestine, but I think it's not perfect for what we want to do, especially with our new information with the grief.
Got it. At least now. Got it.
Okay, yeah, great. I think, again, I'm so pleased. Every single person has had such great contributions to this. And then I can't know exactly what's going on, but based on your questions, based on what you say, it seems like everyone's really taken on a completely brand new system and really they're getting a real sense for it. Again, you have to have some kind of fundamental sense of the system. I feel like everyone has. It's a little bit hard for me to interact with you guys, I don't know. But so far, especially for you, I've interacted with you for a bit. Seems like you've got a good sense for the system. So I think it's our very ambitious goal of being able to use this first thing Monday morning. I think it's working really well. So this is very pleasing for me. It's a huge effort for me. So it's really nice to see all this happening. So thanks. I'm going to move away from the live stream now and then come to Dennis. Can we pass the microphone, and can you tell me the team name and channels, please?
Hi. What would you like?
What do I always want?
Samurai.
Oh, late. You've been keeping that in your whole pocket the whole.
No, it's Lindsay.
Lindsay's
she came.
Lindsay's
passed the credit to the other group I was in that didn't get.
Lindsay's already won everything. Otherwise, I give it more things to her.
She came in. She said it before she even sat down.
Okay, Lindsay, this is so great. Now I've heard hundreds of names at this point. That's up there, right? So next time when I have the class, I'm going to say there was really memorable names. Samurai, excellent. Okay.
I have friends who need books.
You still? Lindsay, all right, that's great.
Parlay that to make friends.
Lindsay, okay. Leslie, where's your pen? Which friend? Which friend?
Or do you?
I have one already.
Okay, yeah, Giselle, please.
Okay, Giselle, can you spell your name for me because I'm getting tired?
With my loud voice.
And husky.
I-E-L-L-E.
Okay, good. I thought so, but I'm getting tired.
She said that with her symmetrical face.
Dennis, I made it pretty clear. Who gets to like this.
All right, I thought we were done.
No,
it's after 5.
At 5:30. You're on your own. You can do any jokes you want. But now it's my time still. Thank you. You pass back then. Just
I did.
Okay, so we got the name. Now, can we discuss some of your channels, please?
Okay, so I'm a little taken by the new news about the grief.
Yeah, again, I put a little bit extra weight because it just popped up, and so I always pay extra attention to that.
So, as often is the case, is we get a symptom, and then we have to put it together with the other collection of symptoms and decide whether is this an excess type grief or is this a deficiency type grief.
Can you walk over to Giselle right now and say, is it okay if I look in your scalp?
Okay.
I want to know how much weight we want to put this on, and your observation will help me.
All right. Can I look into your scalp?
Thanks, Giselle.
Okay. Yeah. Okay, I got it.
Is it really dry and flaky?
It's pretty dry and flaky.
Okay, great. Okay, so, but again, that's otherwise we were just going on Leslie saying that, so that's valuable. But it's so always great to just look.
Mm-hmm.
Okay, so good. So was your top idea to supplement pericardium?
Our number one was the supplement stomach.
Oh, so you already take into account the.
Mm-hmm.
Okay, great. You're just intuition that she had dry skin because her skin looked normal to me besides the scalp.
Yeah, there was some other things. The voice.
The voice is more kidney, small intestine dynamic.
I think we changed that when we heard that. Yeah.
Okay, great. Yeah, that's again. I love this flexibly responding to new information.
Yeah, I mean, we were all over the map, to be honest with you. So
sounds like clinic.
Boiled it down eventually. And then secondarily, we picked pericardium.
Great.
And then third,
can you turn around and look at Giselle's face? And then I'm going to ask you a question while you're looking at her face.
should I ask her? I can look at her face first?
Yeah, for sure, yes.
Can I look at your face? Okay, go ahead.
Can you look at her and can you imagine her getting really, really angry? Me neither, Dennis. I can't really imagine her being really angry.
Well, maybe not expressing it. I can see her being angry, but not necessarily expressing it outward.
Yeah, but she doesn't have that "I'm going to come after you" Tyson energy.
Right, yeah.
It's really soft, and she seems really soft and thoughtful to me. So I'm sure she had that blast of anger, but now we have that maybe underlying grief with it. I could see her feeling sad. Look at her face again. Could you see her feeling sad?
Yes.
Okay, me too.
I would, before this class, I would say that she has a kind of an earthy
element. But now you don't talk like that anymore.
Oh, we don't talk about that. Okay. Wow. I'm scolded left and right. Go ahead.
I just have a few more minutes with you, so I've got to get them in.
Got it.
Okay. So anyway, so great. So this is excellent, right? I don't see her being really furious.
Mm-hmm.
Her skin's super dry. Mm-hmm. And what do we there seems like a little grief to her. Okay. What's your third idea?
So looking at the menses and the dysmenorrhea.
No dysmenorrhea, right? She's good.
Yeah. Pain.
No pain.
Oh, not pain. Oh, what was it?
Mucus.
Oh, there was a mucus. Oh, okay. Why did I think pain? So what do we have? We have bladder.
No, we had been thinking small intestine, but you said not as prominent to that one.
She's really pretty, and we have this husky voice and kidney, so there's something there, but her chief complaint, what does she really want treated?
She wants treated like the grief and this anger.
Oh, sorry. She would like the.
She wants. I think digestion.
So,
thanks, guys.
Isn't there a organ system that is dry, that treats dry on the outside, wet on the inside, that has to do with the digestive system?
Mm-hmm.
Okay. So this is now you see how we're narrowing this down? Again, we start off with our 12 baskets, and then we see Giselle and we start adding things to these. And then we just kind of come around. Anyone here or on the live stream, talk me out of supplementing stomach for Giselle as our top idea. We're only going to be able to do one today. So someone please talk me out of this, including Giselle. Oh, Leslie would like to. Can you pass to Leslie? She would like to talk me out of supplementing stomach.
The one thing that I see that I would go against supplementing stomach is the fact that this anger / grief came out of having to do this work, that there's really no payment for this kind of, stomach excess sort of relationship.
That's a great point.
Stomach excess, with under-resourced as opposed to, so if it had been a picture with a moist skin, which I did see moistness in the skin almost everywhere else other than the top of the head, then and a dry internal, and I was going to supplement lung, I would think, yay, that's a lovely thing to do for this person, to puff them out and resource them and bring them that kind of energy, but to supplement the stomach, and I'm not 100% against it, this is just my one consideration, is that it moves in the opposite direction.
Great.
Yeah.
What's her bowels like currently?
Oh, currently, gosh, I don't remember, but what I did ask her, which I forgot to tell you guys, am I fired? Is
no CEUs.
No CEUs.
Thanks for being here for 16 hours, but you're going to get 0.
I'd be here anyway. That the thing is that there's when the constipation is there, it's not a matter of tenesmus. You're good with me talking about that, yes. But it's more like just a lack of chi, just like a lack of movement.
Okay, let's come up here, Giselle. We'll treat you. So everyone can kind of gather around. Let's give Kevin priority, and then gather around Kevin. Okay, but let's let him get set up. We'll have Giselle lay on the table. Giselle, why am I holding this tea with both hands?
Get your hands warm.
Onto me. If you don't mind, this Giselle, this will be on your head, and this will be underneath your knees. No, yes, no problem. I worked with patients on Tibetan Plateau. No problem. How about a blanket or something like that for Giselle, just in case she gets a little cold here?
I also want to show you, since others have been observing, my thenar eminence.
Oh wow! Look at those. Beautifully rounded, gorgeous thenar eminence. So let's just treat now. Kevin, let's get a shot of her tongue. Wait, and then Kevin, come over.
That wasn't the streamers didn't hear that last comment.
Look at these thenar eminences. Wow. Look at those things. Gorgeous. Skin slightly dry here too. So this is going to be perfect. If we don't mind, I'm not going to look at her tongue, but please get a shot of it.
Okay, hold on just a second. I got to make one more switch. There we go. Everybody see that okay? Nice. Thank you.
Okay. Any last minute reasons not to supplement stomach for yourself? Okay. This is why I do that. I just wait till the last minute. I forgot. Are you familiar with Saam combinations for stomach? Okay, this is a really easy one. So. Somebody mean here wanted to give you pericardium, but I wasn't going to allow it. Sarah, why am I needling on the right side of her body? Yes. Ready?
Hold on just a second. Let me get a little closer shot.
It's really easy.
We're doing SI4,
SI5, because we want to.
Okay, we're at it.
Okay. Notice the angle, right? With the channel, I twisted clockwise to supplement it. That's a great shot. Okay. I'm getting the hang of this system.
Looks like you know what you're doing.
Are you ready?
Let me get around and take one side here.
You doing okay? Feet are real cold. Ready? Okay.
Okay.
Leslie, what's the next point? Right, this is always really nice, right, to accentuate the tendon that we're going to go under. It's nice to pull that out and see that. Sorry, Giselle, I'm trying to accommodate the camera. Now I'm accommodating you. You okay?
Yeah, that was fine.
Okay, good.
Yeah.
Next point, I'm going to forget about the camera, okay? Just in case it won't be simple.
Toby, was that a 1.5 inch needle?
Okay. You feel protected from the wind enough? I was really worried about it. Kevin rigged up this whole thing just to protect you, right? I didn't want
So sweet.
Yeah.
Oh, I noticed that.
Yeah. You can feel under our care, right?
Yes.
Okay. Good.
Comment on the line.
Sorry? Kevin. 3 deep breaths, please. Great. You just have to pretend like the class is not still going and you're in a private treatment room, okay? We're going to keep going with our class. And then, let's just take a 2-minute break and then we'll come back and do our class, okay? Leslie, stay with Giselle. Are we still in doing everything? Are we still live streaming everything? Okay, great. If everyone can come back, this is possibly one of the last prizes, especially this is for you, Dennis, possibly. For the classical texts, common people protect themselves from arrows, and the sages protect themselves from what, Dennis? I got it here.
Send it to somebody else. I don't know the answer to that.
Okay. Live stream people, maybe you could Google it real quick. Common people protect themselves from arrows, and sages protect themselves from what? Kate, that's really close.
Wind.
Yes, Sarah. Sages protect themselves from wind. Sarah, what would you like to win? Do you want some cat hair with some cotton on it? A book? A bumper sticker?
Can I have the channel, or I mean the character?
Give your name to Kate and you can. Great. I think Giselle knew that one. Okay, good. Anything special?
I guess about movement in the stomach. Like 15 seconds after all the movement.
Are you just trying to make us feel good, or you really felt movement in your stomach?
I mean, I'm feeling like gas movement.
Yeah. Leslie, okay, great. Leslie, where's this that most prominent acne on her face? Where is it?
Or stomach channel.
I think it was
stomach channel, right, coming down from the pupil.
And what side's it on?
And it is on the left.
Wasn't that good needling then?
That was excellent needling.
I just noticed it now, so that's just nice confirmation for us. Good.
What do you mean?
No, I just noticed it. It's damp, so I think it's going to take a while. Sometimes this will quickly change, but
yeah.
We'll see. We got digital picture early, so we'll check it again. Another 15 minutes. How much time's elapsed?
I think about 5 since.
Okay, yeah.
So
So we'll see in 15 minutes.
Came back.
Great. That's going to be really close to the end of the class. you can kind of like lightly listen to this, but I'd much rather you have your eyes closed and inside. Mostly you'd be in private rooms, so we just have to simulate that.
Yeah.
We're going to continue talking about something that Orly's going to do. Yeah, microphone to Orly, please. Kevin, can we get back to my slideshow? Orly, do you have a microphone?
I do.
Can you read this, please?
Yes.
This is what I'd like you to think when you go into your treatment room first thing tomorrow morning. I'd like you to think of these. Is it too far away, Orly?
Yeah, I'm just pulling it up on my...
This is so far away, so you want to say
No, that's okay. I'm right here. It's the diagnostic first principles?
Yes.
Okay. Is this patient dry or damp on the inside?
I'd like you to ask yourself that first, that you know about this in physics, they call about first principles. So I tried to make that for Saam system, diagnostic first principles, like the most fundamental things you're going to do.
Okay.
So tomorrow morning when you go in and see your first patient, you're going to go in and say, is this patient dry or damp on the inside? And then what's the second question you're going to ask yourself?
Is this patient dry or damp on the outside?
And 3?
Is this patient flushed and loving?
And then?
Is this patient cold and afraid? Are things moving too much in this patient? Are things too consolidated in this patient? Is this patient too intellectual and withdrawn? Is this patient too reactive and aggressive? Is this patient too bright and open? Is this patient too dark and shielded?
We're just so lucky there's only 12 channels, right, Orly? Because that's a lot already to toggle in our minds. I can't imagine if there's more channels, right?
Correct.
It's too much. Orly, are you still up for talking?
Yes.
Just a quick review of that case. Do you mind reading this?
Okay.
Pass it to Shauna, the microphone. Can you read that, Shauna? Your bright eyes.
Sorry, I can't.
Okay. Flow with whatever may happen and let your mind be free. Stay centered by accepting whatever you are doing. This is the ultimate.
Orly, you might want to do this, say that, look at that quote just before you see your first patient, right? One more time, Shauna.
Flow with whatever may happen
In clinic.
And let your mind be free. Stay centered by accepting whatever you are doing.
In clinic.
This is the ultimate.
It really is. This is the best job in the world. This is the best job in the world. There's no comparison. So, especially Zhuangzi, you're not supposed to have your favorite Chinese philosophers, Shauna, but sometimes. Shauna, do you want to play a little game? The last few minutes. First, real quick, this one.
Skillful action relies on customary rules of practice. Reality, however, is never constrained by such rules.
You see why I love Fei Boxiong? Hey, Shauna, do you want to play a game?
Sure.
Okay. Ready?
Yep.
The game of this is called cell phone, the patient's cell phone as diagnostic window. Ready?
Okay.
So I'm going to tell you what's happening with the patient's cell phone, and you're going to tell me which channel you're going to supplement based exclusively on what's happening with their cell phone. Ready?
Okay.
What channel would you like to supplement? That's the only thing you know about the patient.
Stomach.
You want to supplement stomach for somebody that has the latest iPhone because they're so full of resources that they have everything that they need and we're able to purchase that?
Oh, I'm sorry.
No, that's exactly right.
Okay, great.
Right?
Doubting myself.
Leslie?
Okay.
You know what Call of Duty is and Grand Theft Auto?
I want to supplement PC here.
2 for 2. you know what dark mode is?
I'm assuming it's don't call me. I'm
No,
not,
that's a good guess. Sanjiao excess people, where they put all their devices on dark mode. So that means
we're
like,
tonifying liver.
is that right?
We're supplementing.
No, you're right.
No?
You're
Okay.
right. But I've
your device is on dark mode. Is what
Yes.
you're here to show me. Okay,
Yes.
got it. Got it. Thank you.
You're doing great on this game.
Is this maybe somebody who's not well resourced? So we
Sorry?
not well resourced person, perhaps. So we're gonna supplement the supplement the lung.
So I couldn't just hear
The
what
lung.
Yeah.
This person might benefit from a little bit of gallbladder energy.
You're just getting coy about this game. It's doing great.
I think a little SI might be in order.
Sparkly cell phone cover. You're right. It's flashy, but
Okay.
does that make any bright reflections from all this sparkly?
Bright reflections.
Because they're so shielded, they need to have a sparkly thing to just give it a little spice of life. Would you ever put a sparkly cell phone cover on you?
No.
Not in a million years, because you already are so stimulated with everything as it is. But somebody that just needs to feel something, anytime they can possibly feel something, when they get a sparkly cover that's really bright and shiny, and they would never put their phone in dark mode, right? So who would that be?
Okay, I guess you're saying this is a liver person would do this, so they would need to be.
They would need
Sanjiao
brightness.
supplementation. Yeah. Okay, I guess I was going with a kidney excess with this one.
For sure, that you could consider this.
Okay.
I diagnosed 2 patients become from sparkly things, and I supplemented liver for both of them.
Okay.
One was a fanny pack that was all sparkly, and one was I supplemented Sanjiao because they had all these sparkly things: sparkly shirt, sparkly fanny pack.
They're
sparkly,
drawn to it.
sparkly
They're
phone.
balancing themselves in a way.
Who goes to Vegas? You and I, or a liver excess?
We don't.
We do not go to Vegas. What we do is we stay at home and read a book or something like that. It's plenty of stimulation. These liver excess, they don't feel anything ever, so they got to go to Vegas. There's light, and it's bright, and everything's coming at them. They start to feel a little something that way, so that they're really drawn to Vegas. You and I would like to go to Boulder, Colorado, and go in nature and read a book. You know these apps? Billy's gone. Anybody else do any tech stuff? These are productivity apps.
So this person might benefit from spleen supplementation.
Perfect.
Okay. We had a patient like this the other day. Okay, this person needs some small intestine.
Yeah.
Small intestine.
These are all apps like to see what's happening with your family. Are they okay? Are they okay?
This person, I would supplement UB.
Supplement UB for someone that's already this fearful?
Oh, I apologize. I would supplement, this person has heart
Fear.
excess. Oh, it's fear. Okay, okay.
Because they're so afraid they're tracking everybody all the time. Where are they? Where are they now? What's happening?
Okay, I'm thinking this is like the mom who's just taking care of everybody outside of herself. Sorry.
But this
that
is out
mom.
of fear.
Okay,
Otherwise,
fear.
she'd be the mom that really loves about them would just be,
Got it.
with them and warm. But instead, they're not with the kids. They're tracking where the kids are because they're afraid. Did they get kidnapped?
Okay, so we would want to supplement heart in this case. Okay. Okay, so this is the UB supplementation person. Okay. We would consider that this is Toby. Okay.
Remember, my wife likes me because of my what?
Your excellent personality, as do we all. Oh. I think this person needs LI supplementation.
Yeah.
Okay.
So they're bored. They're just playing Candy Crush.
Okay.
And also sweet, right? So I thought that was good.
Oh, that's good. Yeah.
Here's back to our methane bubbles.
Thank you. That was fun.
Because really, really needed that towards the end here. Okay. Everyone, thank you so much for coming to this discussion of the Saam acupuncture tradition. I'm really pleased to see where we started and where we ended after all this 16 hours of discussion. It's just so, this is real, I have so much joy watching you guys grow in this tradition. It's an absolute pleasure for me. I was in this tradition a long time just by myself, and so now it's so nice. I have fellow students of the Saam system, and it's a real pleasure to share this system with you. Thanks so much. Back in just a minute.